we've actually got a poll, and I wondered if people could just click on the poll as you listen to Andrew as well. What projects that we're demonstrating here are of interest to you? What are your priorities? It'd be really great to get your feedback on that. Again, multiple choice, so you can put in more than one. Andrew, I can see you on the virtual stage. Let's see your face. Excellent.
Good morning, Joan. Can you hear me?
Nice to see you. Absolutely.
That's a good start. Hi, you okay?
Over to you.
Thank you. So yeah, good morning, everybody. First of all, I'll start out just by doing a little bit of an introduction in terms of who Looking Local exactly are. So my name is Andrew Jackson. I'm the head of business development for Looking Local. It is a slightly unusual setup with us in the sense that we are co-owned by another local authority, in this particular instance actually Kirklees Council over in Huddersfield, West Yorkshire area. The best way to describe how we operate as an organisation is that we work very closely with Kirklees Council and also indeed a number of other local authorities, but primarily over the past 5 or so years, most of the work that we have been doing has been around providing these self-service and assisted self-serve digital type alternatives to what were sort of otherwise very much either a sort of a face-to-face process or a very sort of manual staff-led process. We then act as the model which then looks to go and scale that and share, I guess, that success across the public sector. And what I'm here to share with you today and talk a little bit about is a product which is now called Better Care Support, and that's following the output of the co-design that happened from 6 different local authorities. To start off with this, I'm going to talk a little bit about the shared challenge that our co-designing local authorities were experiencing at the time, and really the root of the problem for them with the care and support assessment is that their current CSA process was very heavily reliant on home visits, and I think that caused a number of issues. First of all, logistically very challenging, with workers spending a significant amount of their time travelling. We can give one example actually from Lincolnshire County Council. They said that it was quite common for their social workers to have hour-long drives in between each appointment due to the rural nature of the county. And I know a number of other local authorities would have that same kind of dilemma as well. Certainly costly, so an average cost per CSA across our co-funders was at £160, just over £160. And the slow processing times, and to be honest with you, COVID-19 has certainly not helped at all with this. I'm sure many of you will be aware, but you've only got to look as far as the most recent ADAS SNAP survey, which was published a few weeks ago, which states that there's around 300,000 people who are currently waiting for care assessments and reviews. So that just really gives you an idea of just how challenging the times are with this, and obviously a number of local authorities who are needing to kind of scramble to deal with those backlogs. High level of demand, and I think it's also fair to say that and again, this is another area which the pandemic has certainly affected things, that a proportion of users were expecting to see an online option for completing their care and support assessment. I think one thing that certainly has changed with the pandemic is that people are more used to online and digital, and I guess more comfortable with going down that route when they choose how to engage with their council. And certainly, when the first lockdown happened last year, a number of service areas within local government were needing to kind of quickly scramble to have some kind of an online presence, because at the time obviously there were real difficulties with that. One of the biggest shared frustrations with the current CSA process at the time across our co-designers was that they felt that assessments were not strengths-based. And this is really the messaging that we try and reinforce throughout the user journey on Better Care Support. So to summarize, to be honest with you, unsustainable and a poor experience for both service users and staff. If we go on to the next slide, please. So to talk a little bit about who was involved in the project. Looking Local, we were involved as the developers, the technology developers in this particular instance, and of course CC2I involved with setting up the co-design and the collaboration. But across the different local authorities, we had Lincolnshire, Solihull, Coventry, Dorset, Oxfordshire and Medway all involved with this project. From a looking local perspective, to be honest with you, this was really an extension of the work that we had undertaken around digitizing financial assessments. This was an approach that we originally developed with Kirklees Council. Kirklees went live and implemented their self-service online financial assessment, which is called Better Care Finance. They did that back in early 2017, and one of the big success stories for Kirklees since implementing that self-service OFA is that 80% of their citizens are now self-serving using that platform. So really, I guess this is a continuation of the work we had done on that, and we were trying to, I guess, bring some of the experience and lessons that we'd learned from that, because from our perspective, there was no reason why that same success couldn't be taken into a project around digitizing the care and support assessment instead. So, and really, in terms of the aim of the co-design was to explore an animation approach and how a digital platform can address the different care and support models. Onto the next slide, please. So to talk a little bit about the features within Better Care Support, so the platform is very much animation led. So there are 40 plus animations that lead users through the 10 different areas of the Care Act. The animations really help to set the scene for each of those Care Act areas, as well as providing preventative ideas and solutions that make use of support in the community and also the user's own network. A lot of effort has gone into making sure those animations are easy to understand, relatable, and they help users to complete their assessment by coaxing best quality responses from the service user. We're able to offer integration support for council back office systems. There's also reporting capability. It's an accessible user experience as well as meeting AA accessibility standards. The site has also been developed as what we would refer to as a mobile first application. This point is certainly an interesting one around swift access to the right care for council customers, and one of the kind of key features that we have within Better Care Support is its ability to signpost to local preventative resources, services, information and advice, and all of that quality information is all tailored to the service users' assessment responses. So it's a highly personal experience for each person using the platform. We've ensured that the language used on the animations and also throughout the assessment is simplified language reflecting plain English, so it's easy to understand for those who aren't social care professionals, and that can certainly with the previous CSA process, a number of our co-designers, that area was certainly a challenge. And it works for multiple different delivery models, so free conversations, strength-based practices, and also classic Care Act assessments. Next slide, please. So what I really want to try and do for you quickly during this quick session is to give you a bit of a preview of those animations. Now, the animation which is on the left-hand side here is an introductory animation. So each area of the assessment begins with one of these introduction animations, and this really helps to set the scene for the user and gives them an idea of what the section includes, as well as providing some visual cues so that they can start thinking about their own situation. If we could play that video, please. Sound, there doesn't appear to be any sound coming through on the video. I don't know if that's something you could perhaps look at. So this is often going to be the way, especially doing sort of like an online event such as this. One thing that I think that we can potentially explore instead of this, Sam, is that what you can do certainly with the next video is that there are subtitles available. So if you turn on closed captions under the settings, we can just use the subtitles for now. I am going to be doing a full demonstration of this during the lunchtime session, so I will cover the animations there where you'll actually be able to see them, hopefully with the sound working. Perfect. So what you'll be able to see here playing now on the right hand side is a scenario video. So we would have the first introductory animation. Following that introductory animation, there would also then be a triage question, and then depending on how the service user answers that triage question, they would then be presented with this scenario video. And the main objective of the scenario videos is to get the user to really start thinking about their own situation. And I guess that is still again around sort of getting them to sort of imagine the sort of strengths-based approach and how they can best kind of self-assess in this particular instance. This video is around one's ability to get dressed and if they need any sort of help at all with that. So the video is nearly done here. I think if we just go on to the next slide, actually, because again, I will ensure that we cover these animations properly during the demo session. Hopefully we won't have any technical difficulties with that at all. But I just want to talk a little bit about the benefits with better care support. So first of all, service providers being able to make informed decisions about care packages without the need for a home visit. And additionally, I think another really important point to make with this as well is that when a user has already submitted their self-assessment via Better Care Support, the council has access to early user provided information on in which to base an initial conversation or engagement with, rather than going in cold to that conversation. And I think that's quite an important point to raise there. Substantial savings to local authorities. So the estimated return on investment for our co-designers ranges from 250k to 500k over a 2-year period, and this is based on a rather modest 30% shift to better care support in year 1 and then a 40% shift in year 2. It reduces backlog, travel and assessment processing times, allows for resources to be reallocated to vulnerable and more complex cases, and avoids all but essential home visits whilst retaining the highest possible levels of service and quality. The final point here around, it also reduces the volumes of unnecessary contact from individuals who don't meet the eligibility criteria, so which is another important point to raise. Now, I do also, just prior to finishing here, I do also want to touch quickly upon the user benefits. I think one of those key benefits being that they have access to sort of signposting and preventative resources much earlier than in the previous CSA process. And whilst these animations have obviously slightly backfired today with the technical difficulties, to talk a little bit more about the animations, and I do really want to be able to actually show you how rich and informative those animations are during the demo session at lunchtime. But animations, and the reason why we've kind of focused on the animations being the heart and soul of this approach and this platform, is that I feel that animations can support people with different literacy levels and language barriers. I think they're also very useful when you need to convey lots of sometimes complex information in a short space of time. I guess it's taking that concept that a picture tells 1,000 words, and that can certainly be a very powerful tool in getting someone to open up about their own circumstances. So if we can go on to the final slide, that is it from me. So thank you very much for listening. I'm sure the slides are going to be shared with everybody afterwards, so please do get in touch if you do want to find out more or arrange a separate demonstration of the technology. But of course, I will be there presenting during the lunchtime session as well. So.
Brilliant, thank you, Andrew. And always with these things, we tested it, didn't we? We tested the videos just a couple of days ago and they worked. The videos are amazing. So if you do have time over lunchtime to join Andrew in his session, it really brings it to life. And I think it's over 50 animations in the platform. So it's really rich, isn't it? Yeah, fabulous.
Absolutely.
The link is there for Andrew's session, and we will be dropping all these links in the chat as well. So Andrew, thank you for your time. Apologies again. You know, hey, it's like we just tripped on a real stage. Sorry.
Rock and roll.
Everyone's used to it. Yeah. Okay, brilliant.
Brilliant.
Thank you, Andrew.
Thank you very much, Jane. Thank you, everybody.